Is exercise an effective treatment for anxiety? My name is Dr. Bliss Lewis. I'm a psychiatrist and an integrative medicine doctor, and let's talk about exercise, and specifically exercise as a treatment for anxiety disorders, either alone or as an add-on to other treatments. So we have some research in this area. Also, there are so many different types of exercise that the research is like a bit scattered. But there's definitely a good amount of research evidence, and the research looks promising, right? So it's not like, oh, completely clear and overwhelmingly better than any other treatment. It's looking good in the research. It's in some research studies, it comes out more or less equal to medications. In many research studies, exercise comes a little below medication in effectiveness or a little below cognitive behavioral therapy, right? So the research study compares exercise, some kind, whether it's yoga or Tai Chi or HIIT or cardio or something, running, to medication for anxiety, such as an antidepressant, to psychotherapy, to something like stress reduction. Stress reduction doesn't look as good. And then medications, therapy, they look pretty close. And exercise maybe is like right behind, right? So pretty close. So that also tells us that for milder forms of anxiety, maybe exercise is all that is needed, right? Maybe before it's like a full-blown clinical condition. It might be something to just have exercise built into life to not develop anxiety, not develop a clinical condition. But for someone who already is dealing with anxiety, or maybe already is on medication, or already is in psychotherapy, plenty of research showing that adding exercise to the other treatments for anxiety will give additional benefits, right? So there's research on yoga, right? The numbers in the research studies are not huge, but yoga looks good. It does reduce anxiety. There's research on Tai Chi. Tai Chi looks good. Practicing 2 to 4 times a week will reduce anxiety. Then high-intensity interval training works, right? That one looks particularly good. So intense exercise might be particularly beneficial for reducing anxiety. Cardio, other types of cardio also looks good for reducing anxiety, right? So it could be like just figuring out what type of exercise fits your personality, fits your life, and including enough exercise to make a difference for how you feel, right? So we're all different and we have different genetics. One gene that's involved in this is BDNF. BDNF is about this growth hormone in the brain. And we have no medications really to significantly increase this BDNF, and exercise is a way to increase it, right? So some people who have a genetic variant and have low BDNF levels will need a lot of exercise, right? And other people may just need a little bit of exercise, right, to get the same benefits for mental health. So you will need to figure out your own dose by trial and error. And the kind of the standard, like the average recommendations by like many of the the Cardiology Association is something around 150 minutes per week, or something like 4 times a week, 3 to 4 times a week, 30 minutes, right? That's like, okay, that's something, right? So figure out like what's actually effective for you. I think building exercise into a daily routine, ideally having movement every day, right? And it might be simple things like walking to work, or a walk during lunch, or some stretching, and then building in some more intense exercise somewhere in the week. Or you maybe know that for you to feel well and not be anxious and to really enjoy your day, you need to exercise, intensely. Maybe you need to do cardio. Maybe it needs to be in the morning, right? I definitely have a few patients who specifically find cardio in the morning is a way to not be anxious throughout the day, right? So investing that 15, 20 minute morning time into cardio exercise of some sort, then protects them from being anxious for the rest of the day. It's so personal and individual that you need to figure this out for yourself, right? But worth doing a test, worth doing a trial, especially people for whom taking medications is either not an option because they don't tolerate it or whatever reason, don't want to take medication, have some really significant side effects, right? Extra reasons to look for additional things to support mental health. And of course, you want to discuss this with your mental health provider, with someone you're working with on your overall health. But definitely, there's enough research evidence to add exercise to the treatment regimen for anxiety.